Well, today we're continuing our series with Dr. Stanford Owen with the Center for Health Management here on the Mississippi Gulf Coast, talking about diabetes and things that you can do to make your life better if you or someone that you love is dealing with diabetes. Dr. Stanford Owen, welcome again to the show.
Thank you.
Let's talk first about kind of getting started with this. And you talked about PrescriptFit last time we were on. We've talked about it a few times. Let's start from the beginning. You're diagnosed that you have diabetes. So where do you go from there?
We can start from the beginning, you're just diagnosed, or we can start at the end. You've been diagnosed and you have severe complications of diabetes. We can start from either point. And the most important thing to do is identify what you want to get rid of. For the most part, in symptoms, it's fatigue, breathlessness from cardiovascular problems, heartburn, joint pain, back pain, depression and neuropathy, painful neuropathy, and even sleep disturbances and headache. Those are the 8 core symptoms that you see with type 2 diabetes. And then secondly, identify what you want to get rid of in terms of medication and medication therapy, especially insulin. As I've stated many times in my clinic, insulin, if you've gone on insulin, I've failed. So our goal is to get you off insulin and reduce your medication burden as much as possible. Nutrition therapy is the first and primary treatment of type 2 diabetes. And if you've not had a 12-week intensive nutrition therapy application, that's what we do.
And that's very important, is the nutritional therapy part of it as you get started. Because, basically it's because of your lack of good nutritional decisions is what's put you probably there in the first place.
Well, as I've said before, type 2 diabetes is caused by food.
Right.
Type 2 diabetes can be remitted or treated or even cured by food. And it's that simple. So our strategy is to help you be able to remove the toxic foods that cause type 2 diabetes and manage them. That you're not going to remove them permanently. Add foods into your environment that do not provoke diabetes, and then improve, wean you off your medications.
Is it hereditary?
Yes, it's a strong hereditary tendency, but you don't have to have the diabetic
I was going to say,
gene.
but exactly, even though it's maybe hereditary, you can keep yourself from getting it, again, through proper nutrition.
In the early part of the 20th century, approximately 2 to 3% of the population had type 2 diabetes. It's now upwards of 20%.
Wow.
The genes have not changed that much in 100 years.
And Mississippi, #1 on the list.
Sure. So the first thing to do is inform your doctor that you're going to do a 12-week intervention. You've made up your mind. You want to get rid of these symptoms, get rid of these medications. You're going to do a 12-week intervention. Inform your family that you're going to be bringing in foods into the house that you'll be eating more of, and you may be slowly removing foods from the house that are causing your type 2 diabetes, such as animal fats, pork, beef, and dairy, especially combined with starches, wheat, corn, rice, potatoes. So bread,
sugars,
but cereal and milk, bread and butter, rice and gravy, pasta and cream sauce, French fried potatoes,
all those things that we usually like to
cakes,
eat.
cookies, and so forth. You want to wean those out of the house as you're bringing in seafood, poultry, non-starchy vegetables, lots of eggs, nuts of every variety, whole fruit. You want to bring those into the household. And of course, use PrescriptFit initially as part of the treatment, and then long-term part of the treatment to help repair your cellular damage from the diabetes.
So, I know we've talked about it so many different times. PrescriptFit, PrescriptFit support. I mean, there's more to it than just taking the supplement. I just couldn't think of the word supplement.
Well, we have PrescriptFit products that I developed to help treat type 2 diabetes. And it composed of amino acids with other food groups, egg whites and milk proteins. And they help repair the cellular damage very quickly without the need of insulin. We then add a food group one at a time that is least likely to damage the diabetes all the way up to the high-calorie, high-fat foods. And we teach you how to splurge on those foods twice a week, 3 times a week, without terribly damaging your diabetes. So you're not going to be deprived of these foods long term. And that's a strategy. And it takes about 12 weeks to really sink it in and to see if you are going to respond. And virtually every patient will respond.
So now we've got started. You know, we've informed our doctor. We've made some changes. We've gotten the bad stuff out of the house. What's our next step?
Well, you call us, you establish a support, and the numbers are on the screen. You can contact me directly, and I'll channel you to the right support person. We want you to watch on our website, drdiet.com, the 2 videos that talk about how to treat the type 2 diabetes under About the Program. The other is how to use the products with the food strategies. And then thirdly, to order your startup kit. And that'll actually give you all of the book that I wrote, the PrescriptFit book, that teaches the food strategies, your calendar workbook that lets you follow along, as well as the food products and flavorings and so forth.
So it's important that you kind of keep a log, keep a diary. This is what I'm putting into my body, and again, sharing it with your support group and letting you know, okay, this is what I've done this week.
Yeah, and our support group is primarily to help you solve any problems that you might have. Our record keeping is very simple. We ask that you tell us what phase of the diet you're in, if you did any type of exercise. Even marking 0 will give you a good benefit.
Exercise is important, though.
It's important. If you use any nutritional products and if you splurge, that's all we ask. And it takes about 15 seconds to record that every day. If you record that, you're 85% more likely to control the type 2 diabetes without medication.
That's amazing.
Yes.
Absolutely.
It's that
amazing.
simple.
Well, I know, you know, this is something that's been very important to you for a while now, and the PrescriptFit program, you know, helps people in so many different ways besides, you know, weight and everything, but the diabetes as well.
Well, it's so simple. People think it's complicated, but it's really simple. You add foods that don't cause diabetes to the house, you remove foods that cause diabetes, and you learn how to splurge on them. You get liquid calories out of your life, and diabetes gets better. It's a family deal, though, so you really have to ask your family to help you in this endeavor. You need to inform your doctor that you're going to do this for 12 weeks to see if it will control the diabetes. In very rare cases, we don't see improvement, but 99% of the time, we'll either get good improvement of the diabetes or get you off medication.
That's awesome. So you want to get started on that, there you go. And again, we'll continue our series here in the future about the program and how to help you deal with your type 2 diabetes. If you want some more information, of course, the phone number is on your screen. You can go to the website as well, drdiet.com. Look at the videos, see how it is to get yourself started on that, get your family involved and everyone else, and live a better life. Center for Health Management, located here on the Mississippi Gulf Coast.